everybody, and thank you for joining us. Early on Sunday, I declared a public health emergency of international concern over an epidemic of Ebola disease in the Democratic Republic of the Congo and Uganda. This is the first time a Director General has declared a FIC before convening an emergency committee. I took this step in accordance with Article 12 of the International Health Regulations after consulting the Ministers of Health of DRC and Uganda and in view of the need for urgent action. I determined that the situation was not a pandemic emergency, which is the new and highest classification under the amended International Health Regulations. After declaring the FIC, I immediately convened an emergency committee under the IHR, which met yesterday and agreed that the situation is a public health emergency of international concern, but is not a pandemic emergency. WHO assesses the risk of the epidemic as the high at the national and regional levels and low at the global level. So far, 51 cases have been confirmed in the DRC, in the northern provinces of Ituri and North Kivu, including in the cities of Bunia and Goma, although we know the scale of the epidemic in DRC is much larger. Uganda has also informed WHO of 2 confirmed cases in the capital, Kampala, including 1 death among 2 individuals who traveled from DRC to Uganda. An American national who was working in DRC has also been confirmed positive and been transferred to Germany. There are several factors that warrant serious concern about the potential for further spread and further deaths. First, beyond the confirmed cases, there are almost 600 suspected cases and 139 suspected deaths. We expect those numbers to keep increasing, given the amount of time the virus was circulating before the outbreak was detected. Second, the epidemic has expanded with cases reported in several urban areas. Third, deaths have been reported among health workers, indicating healthcare-associated transmission. Fourth, there is significant population movement in the area. The province of Ituri is highly insecure. Conflict has intensified since late 2025, and fighting has escalated significantly over the past 2 months, with over 100,000 people newly displaced. The area is also a mining zone, with high levels of population movement that increase the risk of further spread. And fifth, this epidemic is caused by Bundibugyo virus, a species of Ebola virus for which there are no approved vaccines or therapeutics. In light of all these risks, I decided it was urgent to act immediately to prevent more deaths and mobilize an effective and international response. I would like to thank the government of DRC, the National Institute of Biomedical Research, the National Institute of Public Health, and the local health authorities in the affected areas for their leadership and cooperation. I also thank the government of Uganda for postponing the annual Martyrs' Day celebrations, which can attract up to 2 million people because of the risk posed by the epidemic. My thanks especially to His Excellency President Museveni for taking this action. WHO has a team on the ground supporting national authorities to respond. We have deployed people, supplies, equipment, and funds. To support our response, I have approved an additional $3.4 million from the Contingency Fund for Emergencies, bringing the total to $3.9 million. In the absence of vaccines and therapeutics, there are many other measures countries can take to stop the spread of the virus and save lives, which the Emergency Committee has outlined in its temporary recommendations. To say more, I'm pleased to invite the chair of the committee, Professor Lucille Bloomberg, from the University of Pretoria in South Africa. Professor Bloomberg, thank you for your leadership at this time, and over to you.